And now for some health news. You may have heard that people with diabetes have a higher risk of eye disorders than people without diabetes. But with regular checkups, you can actually keep them minor, and most treatments work really well if you begin right away. And we're learning much more about it from Dr. Leland Sherlock of Southwestern Eye Center. Good to see you, Doctor.
Thank you.
Great information coming out about this. How does diabetes actually affect our eyes?
Well, typically, diabetics have poor circulation throughout their body. The worst points are their hands, the feet, and the eyes. Unfortunately enough, the eyes are a pretty small percentage of the individuals that we see with diabetic issues. If they do develop any problems, it's usually bleeding or poor circulation inside the eyes. It's called diabetic retinopathy.
Now, does it get progressively worse?
Depends on the case.
Okay.
All different cases, both eyes are actually different. I've never seen two eyes ever the same, so it's kind of interesting to see each individual and how it affects their eyes. Early treatment is always your best bet, though.
Now, can a person with diabetic retinopathy have noticeable visual difficulties?
Not always,
Oh,
no.
okay.
Yeah, typically, and I'll show you, I've got some pictures.
Okay.
These are the worst cases typically, but you notice they have lack of circulation, they have neovascularization, which means blood vessels growing up into the retina, and they have bleeding or hemorrhaging. Well, if you notice, the hemorrhaging on this picture here is actually below the center of the vision, the visual point. So sometimes they'll get a noticeable visual effect from it. Most diabetics on early signs have tiny little dot hemorrhages, and those dot hemorrhages are not visually noticeable.
Wow, interesting. Yeah. Now, what about things like styes or pink eye? Can diabetes cause that?
They're at an increased risk because they have poor immunity.
Okay.
And so the increased risk for any type of infection, any type of eye disease in general, is increased with diabetes because of circulation issues. Yeah.
Well, let's talk a little bit about some of the treatments available.
Yeah, typically with diabetics, when they have a lot of hemorrhaging inside the eyes, we use lasers as first-line treatment to decrease the amount of bleeding inside the eyes. And then we also have new injectable medications that actually pull back the blood vessels from inside the eye, the fine blood vessels that the diabetics develop, and that start to bleed and hemorrhage. So these medications pull these vessels back and allows them to regain vision in some cases. More importantly, is to save their vision. Save it.
And that's what I was going to ask you, is will the sight ever go back to normal, and how long would that take?
It's again, every case is different. Yeah, and every eye. So that's the nice thing of this. That's why we have two eyes. One's a spare.
Yeah.
And so, and I've always seen there's always one eye that's worse or better than the other. But typically, if you do treat it early, the lasers or the injectable medications, we have a good chance of saving a lot of vision. Very few people ever go blind from these types of diseases in general, from diabetic retinopathy. The severe cases are fairly rare, luckily enough.
Well, and we were talking about this earlier, that you're actually seeing an increase, especially in young people. Tell me why. Is it nutrition? Is it lifestyle? Is it hereditary? It's both.
It's hereditary factors as well as lifestyle factors as well. Just the poor eating habits, that doesn't help.
Right.
But the genes are perpetuated, so they're passing more and more of these genes on, and it becomes more and more apparent. And again, especially in the elderly population, because we have a larger elderly population now.
Right.
And so this becomes more and more common to see these issues.
Sure, but we can keep it in check with good checkups.
Exactly.
Very good.
Exactly.
Thank you so
My
much.
pleasure.
Great, important information. And to learn more or find an Southwestern Eye Center near you, go to swi.com or call the number on your screen. And up